have to log back in for you.
All right. So my name is Sam Carlson. I hail from discussion section 308. Shout out to all 5 of you who showed up to discussion last week to help put this presentation together. And a big thank you to everyone who decided to make it out to lecture tonight. I guess you all must be really desperate for those 3 extra points. So the questions that we're going to be looking at tonight are: how is quality of care measured in healthcare settings? And how do you think the provision of quality care increases healthcare costs? So first question, how's quality of care measured in healthcare settings? So quality is kind of a big term and a little bit hard to define, but when looking at healthcare systems, it's important for us to know if we're succeeding or failing. So we need to come up with ways to look at quality that can be measured in some meaningful way. So if you read the U.S. Healthcare Systems textbook, the 4th edition of which we were required to purchase at the beginning of the semester for $77, even though the 3rd edition, which was almost exactly the same, was available online for free, you would have seen the quality measures for healthcare can be divided very broadly into 2 major categories. Number 1, the performance of the entire healthcare delivery system. And number 2, the performance of individual caregivers and healthcare organizations. So on page 306 of your textbook, if you could all turn there with me now. Just kidding. I'm sure that you all lost track of your books 6 weeks ago when you started guessing your way through those quizzes. Anyway, when you get home, I'll encourage you to turn to page 306 of your textbook, where you can see some examples of quality measures in the entire healthcare system, including things like cost, access, and population health. That's the more macro view of things as compared to examples of quality measures for individual caregivers and healthcare organizations, which include things like small area variations, medical errors, patient satisfaction, quality of life, and health outcomes. So again, quality can be a little bit hard to define when it comes to healthcare, but these are generally quantifiable systems or standards of measurement that can be used to determine if we're succeeding or failing. So, second question. Do you think that the provision of quality care increases healthcare costs? Well, before we try to answer that question, let's take a look at what it is about healthcare that costs money. What are a few things you can think of that are associated with healthcare costs? Give you a hint. We did an entire assignment, including a 45-page long grid on one of them. Health insurance, that's right. So healthcare insurance, it's a cost. Here are a few more things from page 292 of your textbook. Paying healthcare professionals. So those of you who are going to be nurses or social workers in the future, someone's going to have to pay your salary. Putting money into healthcare delivery organizations and institutions. So someone has to pay for the electrical bill over at the hospital. How about medical equipment and supplies? You know, who's going to pay for that Foley catheter that someone has to shove up your... Well, sorry. Anyway, you get the point. Healthcare is expensive. But what's one thing that we know about cost as it relates to quality? Well, we know that the two are not always directly proportional. Someone just pointed out, that's okay, that the 17.4% of the GDP in the United States in 2013 was spent on healthcare. That's on page 293 of your textbook, in case you were wondering. And yet, despite the fact that the United States spends 17.4% of the GDP on healthcare, a higher percentage than that of the students who decided to show up to lecture tonight, we still have routinely worse healthcare outcomes than those of other countries. To illustrate this discrepancy, I'll give you two examples by comparing the US to the UK, a country which spends, by comparison, only 9% of their GDP on healthcare. First example, the US has lower life expectancy. Someone already pointed this out. According to page 22 of your textbook, life expectancy for a woman in the US is 78 years of age, compared to 81 years of age for a woman in the UK. Second example, the US has higher rates of infant mortality. According to page 14 of your textbook, 259 children per 100,000 die in the US compared to only 170 in the UK. So why is this? Shouldn't it be that the more money we dump into our health care, the better our health outcomes? Well, I don't know. I feel like that's kind of like saying, the more money I pay mechanics to work on my car, the better my car should run. While that may be true, it's more likely that all the problems I'm having with my car are really just indicative of an underlying problem that needs to be addressed. So, what is that problem as it relates to our healthcare system? I have 5 words for you. Someone already said them tonight. Disease prevention and health promotion. We are a country of unhealthy people. So does it really matter how much money we dump into our healthcare system? Because, if we're all unhealthy, our problems aren't going to go away. You can't buy a higher life expectancy. You can't buy lower rates of chronic illness. Those are things that come from disease prevention and health promotion. So we need to put a greater emphasis on primary health care, adequate nutrition, healthy lifestyle choices, community-based partnerships, and culturally appropriate care. I'm now quoting from page 307 of your textbook. More healthcare expenditures or more intensive use of medical technology do not produce better health. More does not represent better quality. A $350,000 machine can't do more for you to keep you healthy than you can do to keep yourself healthy. That power is in your hands. So, thanks for being here with me tonight. I'd also like to thank Professor Kruger for organizing this course and bringing in so many interesting guest lecturers. And thanks to RN Rainbow for facilitating the fascinating conversations that we had every Monday in discussion. Thanks.
Okay, I think we